Good afternoon, everyone, and welcome to our first webinar for this fiscal year on the SAMHSA SOAR TA Center answers your most frequently asked questions. A quick disclaimer, the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services or the Substance Abuse and Mental Health Services Administration or the U.S. Department of Health and Human Services. Just a few items. The slides and materials are available on the SOAR website. They're also available in the link for the registration that we sent you. A recording will be available within a week, and you can submit questions using the Q&A feature, and all participant lines will be muted and the chat feature is disabled. There is a brief evaluation that you'll be directed at the end of the webinar, and a survey is attached that we ask that you complete for us. So here are some of our objectives. So we're here today to answer some of your most frequently asked questions at the SOAR TA Center, and also how to access our SOAR Works FAQ page on the SOAR website and learn about some other tools and resources that are available on the SOAR website. And you're going to hear from the SOAR TA Center liaisons here at the TA Center, who's going to provide some take a deeper dive into some of these FAQs and show you where you can get some more technical assistance in a broad range of areas. So today you'll be learning more about the SOAR TA Center staff, and as I said earlier, questions and answers. We'll take more of your questions and answers at the end, which will also facilitate. So getting to know us. So here is a map of where you can find your liaisons, and you're going to hear more from them in a few minutes. So you'll see here in red, we have Dazara Ware. In light blue, Dan Coladonato. The purple states and DC is Kristen Lupfer, and Abigail Kirkman, you'll see her states in pink, and Amanda in yellow, and Sumitra Polkato in green. And here is a screenshot of our FAQ page on the SOAR website. You'll see on the banner on the top on the far right is the FAQ link that you will click. And then you can choose by topic. And if you don't find your answer, there's also a way for you to pose a question or submit a question to us. So please utilize that to see if there's a question that's already been answered, or submit a question and we'll get a response, and we use that to populate our, the FAQ website as well. So now kicking it off will be Alicia, who's going to take some of the questions she gets frequently at the TA Center. Alicia?
Hello. Hi, my name is Alicia. I am the newest member of the SOAR TA Center. I split my time between SOAR and the HHRC, that's Homeless and Housing Resource Center. So if you've been on some of those webinars, you've seen me, we're not strangers. The support that I provide is a lot of technical stuff, a lot of website related stuff. So as you see here, my sort of subject matter is online course, resources, navigation, that kind of stuff. When I'm not working, I'm a big baker. I love to bake anything and everything. I'm a film photographer and I love to travel. You can probably tell from these pictures, I love to change my hair every single month. So if you see me on multiple calls, you'll see a new color every time and keep it fun. So I will kick it off with some of our website questions. First and foremost, how do I even get SOAR trained? The simple, easy answer is through our online course. So you can find that on the SOAR Works website. This is the course introduction you see here. It consists of 7 classes. Those have articles within them. They have try-it quizzes so you can test out your knowledge. And then throughout the classes, you'll also complete a practice case. That practice case sort of assigns you a fictional client. You'll see videos as though you were conducting interviews. You'll get case notes. You'll get sample medical records, all of that fun stuff. And then you'll also be instructed to consolidate all of that information and put it into an actual complete SSDI application. That'll include the SSA 16, the 1696, the 827, the 3368, the 8000, and your medical summary report. The course is free, it's self-paced. We don't have any sort of deadlines on that. You can take it as you have the time. I know we're all busy and it's a lot of content. And it's available for anybody who's interested in learning more about SOAR, about SSI and SSDI, or will be assisting with applications. So once you get started with that, one of the most frequent questions that we get is that a lot of times organizations will want several of their staff members to do it at the same time. That is totally fine. However, we do ask that you do independent work. You can chat with each other, whatever, but what you submit to us, we want you to have original work so that we can really make sure that when you're providing that assistance to folks, that we're just doing a good job and that we know we're sending you off with all of the best information. This is the course enrollment form that you'll see whenever you get started with the course. It runs you through about the same thing and gets you started. So then once you get past that and you do take the course, one of the other frequent questions that I answer at the very end of the course in class 7, each of the classes is broken down into several different sections. The last section in class 7 is where you'll submit your completed application. A lot of times folks miss that piece. You upload the documents throughout the course, and when you're going through it, it can seem like, well, I uploaded everything, surely I'm done, right? Wrong. At the very end, you'll have to complete a quality review. You'll click 3 boxes, say that you've done everything, and then you'll actually formally hit submit. This picture at the top is the message that you should see whenever you have submitted your packet, but also you'll get this email at the bottom. It's an automated email confirming that you've received it. If you ever have questions about any of this, our email is right here. It's soaronline@prainc.com. You can always reach out. We can confirm that we've received it. And then one of my personal favorite questions, this one always makes me laugh because whenever someone calls in, it makes them laugh when they realize what they've been getting. So whenever you enroll in the course, you have to do this terms and conditions. At the very bottom, as you can see, it asks you to type I agree. This trips people up all the time. It is very specific. You can't type I agree with quotation marks. You can't type I agree and have a little space afterwards. It must be very specifically I agree. No quotation marks. Otherwise, it'll say that you've done it wrong, and then you're thinking, I know how to spell I agree, right? It's not you. It's the website. It's very picky. So as you can see here, just make sure that you're not doing any of those extra little things, or it will kick it back to you. And then once you do get past the course, you've passed it, you're doing cases, say you change organizations, then what? You always want to be able to access your resources, so you can just log right back into the account. Just because you've switched organizations and don't have access to that old email does not mean you can't log back in, assuming that you know your password. If you do know your password and you have your email, you log in. Up there at the top right, which you can see here, there's the My Account button. You click that, and then My Results, and then User Profile. And then once you're at that page, you'll see this little gray edit button come up. That won't be there until you're on the user profile page. So if you don't see it, back up a step and make sure that you're on that right page. Once you do click edit, it'll take you to what you see here on the right, and then you'll click update email and password at the top. That's where you can, of course, update your email to your new email address. You can also update your county, your state, your organization, all of that fun stuff. If any of it's changed, you can just look it over and update it there. I will say, if you don't know the password with your account, with the old email, of course you won't be able to reset it because you don't have access to the old email. Just reach out to us. We can reset that for you. That way you can get in and get all of this taken care of. Alrighty, and with that, I will pass it to Amanda.
Thanks, Alicia. Hi, everyone. I am Amanda Starkey. I'm a project associate at the SAMHSA SOAR Technical Assistance Center, and I'm the liaison to Michigan, Louisiana, Idaho, Wyoming, Kansas, Arkansas, Nebraska, New Hampshire, South Carolina, and Oklahoma. I'm the subject matter expert in training and development for new SOAR providers. So I really like helping to support new providers as they're transitioning into their position and help them feel comfortable with getting started with applications. A little bit about me. I have 3 daughters. They are on the bottom of this slide from left to right. Harper is 8, Dylan is 6, and Sloan is 4. I also have a puppy named Biscuit and a husband named Chad, and they're in the family picture up top. And in my free time, when I'm not rushing my kids around to all of their sports and activities, I really like taking some time out to mountain bike. That's my self-care. So one frequently asked question that I get a lot is, what do I do now that I'm SOAR trained? I took the training and now I'm not sure what to do with all of this information I got. And I think the best advice when you first pass the SOAR online course is reach out to your TA center liaison and ask what's going on with SOAR in your state and with SOAR in your community. Your liaison will be pretty up to speed on what's going on with SOAR, where you are at, and provide direction on any specifics about how the SOAR model is implemented within your state. So you'll see in the chat box, you can click on the SOAR in your state link to find out who your liaison is. One tool that you can find on the SOARworks website, along with all of our other tools that we have, is the steps to completing SSI and SDI application using the SOAR model. It's really helpful to use this to help guide you through the SOAR application assistance process. It's also helpful just to look over for a review after you complete the online course so that you can synthesize all of that information and begin to make sense in what order you'll be completing all of the documentation for the applications you'll be doing. Another getting started FAQ, how should I organize my files? So my best advice is to make a few files up front so that when you get a referral for a new applicant, you have a file ready and waiting. It's helpful to section it off into SSA forms, SOAR interviews, any correspondence with Social Security, medical records, and releases of information. So that is how I organize my files, and I put dividers between each section of the file. On the first page of my file, I put a sheet down with room for the applicant's full name, date of birth, Social Security number, their mother's maiden name, and the city and state where they were born. And also their application re-entry number. So this is really helpful because this is the information Social Security and Disability Determination Services are going to ask you for to verify that you are calling on behalf of the applicant and you know their verification information. So I like to keep that right in the front of my file folder so I'm not searching for the details when I make the phone calls to Social Security and DDS. Also, when you get started, it's helpful to have a contact list of SSA representatives and DDS examiners that you'll be working with in your state. A lot of states have dedicated SOAR liaisons at SSA and at Disability Determination Services. So gathering a list of their contact information will help save you time. And it's also helpful to give them a call and reach out and introduce yourself before you start submitting applications, just so that you know that SOAR applications will start coming through from you. What about meeting with applicants? How do I prepare for my first intake appointment? So when you are getting ready for your intake appointment, we have a tool on the SOARworks website called the Initial Meeting Worksheet. And this covers all of the bases that you need to complete an intake appointment with an applicant. It provides information on how to contact the applicant if their phone gets shut off, who you can reach out to that will be able to get a message to the applicant for you if you lose contact with them. There's spots to get some great quotes about why they stopped working, what conditions are they experiencing. It provides an opportunity to write down all of their treatment providers and all of the medications they're taking, and also a list of collateral sources where you could look to get more information, like past employers or family members or friends that know a lot about the applicant's functioning. So this initial meeting worksheet is really great for getting started with applicants. It provides an outline of the information that you'll need to complete the basic information on a lot of the online application materials. So beyond the initial meeting, and what you should do at that intake appointment is set up regular meetings with the applicant ahead of time. So I suggest meeting once a week and setting aside 1 hour just as the base for when you'll be meeting with the applicant. It's good to set those meetings up in advance so that the applicant knows what to expect. As you're meeting with the applicant and going through the MSR interview guide at each meeting, I suggest breaking that interview guide into manageable sections. So you're just completing 1 or 2 sections of the MSR interview guide at each meeting, along with 1 SSA form at each meeting. And another helpful hint is after each meeting with the applicant, go back into your MSR template and start adding pertinent details into the correct section of the MSR while the information and the quotes are fresh in your head. It will really help with adding context details about the applicant's behavior, their speech patterns, their ability to answer questions and remember information right after meeting with them, compared to trying to write all of that down at the end of the SOAR process. One last resource we wanted to talk about on this webinar is the self-help guide for applicants. So this is a tool for applicants who don't have access to SOAR services. Another question we get a lot at the TA Center is, what do I do if I can't help someone because they don't meet our program's grant criteria? This self-help guide is a supplement that you could use. It can serve as a tool for any community. It walks applicants step by step through the application process using the same philosophy as a SOAR assisted application. We believe it will increase equity relating to accessing benefits, because even if someone doesn't have SOAR representation, they have the tools and the background information needed to be successful in applying for disability benefits. And this resource is also available in Spanish. All right. Heading over to Abby.
All right, thanks so much, Amanda. My name is Abby Kirkman, and I am the Assistant Director of the SOAR TA Center, along with Dazara Ware. I serve as the liaison to the 8 states, Colorado, Connecticut, Delaware, Illinois, Montana, New York, Pennsylvania, and Virginia. And in addition to my just general work with SOAR, I do a lot of work around expanding SOAR to American Indian, Alaska Native communities, and just overall helping you be successful in implementing SOAR in your state. When I'm not at the TA Center, I am an avid quilter, music festival attendee, dog mom to this adorable little puff named Wilson. And then my husband and I really enjoy going camping in the mountains. All right, so one of the most asked questions that we get is, what should we do if we cannot create a My Social Security account in order to set the applicant's protective filing date? So we know that we want to set the applicant's protective file date online, but oftentimes folks will get discouraged if their applicant cannot create a My Social Security account. If that happens, it is 100% okay. We know that it can be challenging for applicants, especially who may not remember their addresses or may not have access to email to access this My Social Security account. So if you're not able to, we still recommend setting the protective filing date online. And how you will do this is you will navigate to the disability application online as you would normally. You will click Start a New Application. But instead of selecting I'm applying for myself, you will select I am helping someone who is not with me and therefore cannot sign the application at this time. That will bypass the need to create a My Social Security account. You will then input the required information, and it is so, so important that you remember to stop at that reentry number and exit. You don't even want to go one page beyond that reentry number, because that will indicate to Social Security a lead. Now, it is true that if you do use this, this technique, and you do not create a My Social Security account, it will create what Social Security calls an unauthenticated application, which means that they will need to mail a copy of the application to the applicant in order to sign. So it's important to know that it may add some time to the application, but it is much, much more efficient to make sure that you're setting the protective filing date online and being able to file everything you can online. Okay, so we have a really great tool for this. It is a creating my Social Security account flowchart. So it takes you through, is the applicant with you? Yes, no, and how you work with that. Now, we do want to point out that we always want to try to create a My Social Security account for the applicant. The applicant's the one that is going to need to create this, not you as the caseworker, but the applicant. Although, again, if you're not able to create a My Social Security account, it's okay, and you can still set the protective filing date online. All right, so going a little bit into a specific special population. So where can we find more resources about working with Native American communities? So a reminder that SSI and SSDI can be a crucial source of income for Native individuals, whether they're residing on or off the reservation. And there are exceptions for some types of income when someone is applying. The Social Security Administration recently just established the Office of Native American Partnerships, which will work to enhance relationships with tribes and be the primary contact for tribal affairs. Overall, Social Security is really invested in serving in Native communities, and they offer many, many resources, including video delivery, tribal consultation, and tribal ticket to work programs. Within the last year, the SOAR TA Center put out a suite of documents on working with SOAR and Native communities, everything from a frequently asked questions document about working with American Indian Alaska Natives to a medical summary report, interview guide, and template designed specifically in asking those specific questions related to Native individuals. And then we also have an entire toolkit around engaging with Native communities. And this is particularly helpful if you are working in an agency or in a community that is not embedded within that Native community. So how can you work to provide that outreach and serve those applicants as well? All right, and with that, I'm going to flip it over to Daz.
All right, thanks, Abby. I hope my camera is on. It's on my end, but I don't see myself. I still see Abby. My name is Dazra Ware. I'm the Assistant Director here at the SOAR Technical Assistance Center, and along with Abby, and the states that I am a liaison to include Florida, Georgia, Hawaii, Mississippi, Ohio, and Tennessee. I'm the subject matter expert for SOAR implementation in legal settings. And in my spare time, I tend to travel towards the sun, and I am most happiest at the beach. I consider myself an artist and a music lover, and I love to collect the medals from 5Ks, although I enjoy that even more than actual participation. And I am the sole provider of a very, very, very privileged pit pup. His name is Django, but we call him His Highness. So I am very happy that you all are here, and very, very excited to be able to present some information on some frequently asked questions specific to working with individuals in legal settings. The SOAR TA Center continues to promote SOAR work to assist individuals that are eligible for disability benefits that due to their mental health or physical health conditions that are either currently incarcerated or exiting jails and prisons, or involvement in some type of a program under the supervision of a Department of Corrections. So whether that's specialty courts, transitional housings, any reentry programs. So we're really excited to present this information to you. So we really want to promote this so that SOAR can really become that vital resource for reentry efforts to assist these individuals to promote successful transition and successful reentry. And so one of the questions that we get oftentimes are,
is, are people automatically eligible for disability benefits if they have been incarcerated for a long time? So the short answer to that is, when we use the word automatically, it's always no. There's no automatic, and particularly because you know, Social Security views views incarceration in institutions as a living arrangement, and so it's not a disabling condition. And I understand where this question comes from, simply because there's so much history around how this really inaccurate information has gotten around. And so people that are currently living in institutions, primarily jails or prisons, are basically being told by staff that they are eligible because they are there. And so it's not automatic, because again, institutions are living arrangements. And so when we think about people that are incarcerated, we really want to debunk those myths, right? So just, your takeaways here is, a person can apply for benefits while they're incarcerated, which is true, but we are considering incarceration as a living arrangement, right? And it's not automatic one way or the other. So people oftentimes get it misunderstood. They either think because they've been incarcerated, they're automatically eligible, or they also think the opposite. They think that because they've been incarcerated, they can never apply. And so we really want to overemphasize the fact that prior history of incarceration alone does not make someone eligible or ineligible for benefits. And we also want to help you to know that warrants, anything other than escape, do not prevent a person from applying or receiving payments at that time. And so, that word automatic just is a no-go. Nothing's automatic. Some things are case specific, but with regard to their living situation of being in an institution, people still can apply while they're incarcerated. And yeah. So one of the next questions that we'd like to address is, I'm sorry. Okay. Can an applicant apply for disability if they're incarcerated? So I've really covered a lot of that information in my first answer. It kind of bled over into this one. But another question is it necessary to have a pre-release agreement for applicants that are in institutional settings? So we really encourage the use of pre-release agreements, and those are agreements that are established between the institution and either your local or state Social Security office to establish some guidelines on how applications for people that are currently in institutions are going to be received, who would be reviewing them. It's a process by which the institution and Social Security make the agreement of how to receive these applications. And so pre-release agreements are encouraged, and we've seen those be extended to as much as 120 days prior to release, that we've seen pre-release agreements established, and where an application can be submitted in that time. But as a general rule, Social Security allows for applications in institutional settings to be submitted 30 days prior to the expected release date. And so if you have an expected release date, which you will have to have, without a pre-release agreement, those applications can be submitted to Social Security. But, just to overemphasize, we do really encourage the use of pre-release agreements. And that's to help to ensure that the decision can be made, as quickly as possible before the person is released. We want individuals to walk out of institutions with benefits in place. Another FAQ is, how do I document functional limitations for people that are in institutional settings? So this question comes out when SOAR providers are really working hard to write their MSR and do a really good job. And so we really encourage the use of this supplemental support document or resource that helps kind of guide that. And it helps to reduce the bias that is often associated to writing MSRs, right? And so with a population of individuals that are currently incarcerated, not only do we have to address the stigma that's attached to being incarcerated. We don't want to write that as such. So when you are writing functional information to document those limitations, consider their experience in prison and or jail or in that institution in the same way that you would consider it if that person was in the community. So if they struggled in the community, they are likely struggling while they're in an institution, and you would write about that. And so, if they are struggling in the community with interacting with others, they're likely struggling within the walls with interacting with others. So, my encouragement in your answer to that question is to write it as if that person is experiencing this, that write it in a way where the institution becomes the community and not something to kind of discount. They are really struggling in the same manner. It's just that their environment looks different, and you have to really help to, while you're writing, to consider the environment. The people in institutions, particularly if they've been incarcerated a long time, have had experiences that are unique to that environment. And so taking all those things in consideration would be very, very helpful. And sometimes looking at things that you wouldn't normally look at if you were in the community looking at case notes. When you are reviewing institutional files, look at those files that have a lot of disciplinary reports. Oftentimes, maladaptive behavior as identified in an institution is really a response to the symptoms that that person is experiencing. And so maladaptive behaviors in prisons or jail look like disciplinary reports, where if you take a little bit deeper look at those records within that institution, you'll see that those punitive measures that resulted in disciplinary reports were actually documentations of the response to the symptoms that they are experiencing. So take a look at those as well. And so we have tons of resources to help SOAR providers along the way as they do this work to assist individuals that are currently incarcerated or some involvement in legal systems. We have a wonderful kind of infographic that's available to you to help promote SOAR success, and really looking at those, the data that we have and those things. And it's a really good one pager to kind of introduce SOAR to institutions that you really might be interested in assisting with. And another one is a frequently asked questions resource that is specific to working with folks in the legal setting. So it explains the importance of understanding what benefits someone had prior to their incarceration and what are some of the reasons why that's important. And, some of the questions that I've addressed here today, just wanted you to know that those resources are also available to you on the SOAR website. And as you continue this work with working with people in legal settings, please know that I, along with all the other members of the SOAR TA Center, are happy to assist you, and you can reach out to us at any time. And with that, I'll go ahead and hand it over to Dan. Dan?
All right, thank you so much, Desiree. Hi, everyone. I am Dan Coladonato, and I'm a project associate with the SAMHSA SOAR TA Center. I'm glad that everyone is here. The states listed on this slide are the states that I work with. So Alaska, South Dakota, Iowa, Missouri, Minnesota, New Mexico, Arizona, Oregon, California, and Utah. And I was introduced to SOAR in 2012 when I was working for an assertive community treatment team in San Diego. And I became SOAR trained and started assisting with these applications for the individuals within my program that generally had severe and persistent mental health struggles, as well as a history of homelessness. And I feel so passionately about the SOAR model because it worked really, really well for the individuals that my program served, and as well as for the agency that I worked for. And so one of my favorite things about working at the SOAR TA Center is being able to work with individuals who just recently completed our SOAR training, or perhaps a state level training as well, to help them kind of understand and navigate the complicated SSI and SSDI application process, because it is a complicated process when you're first getting started. So I'm glad that everyone is here to learn more about this. So the frequently asked questions that one of the frequently asked questions that I am going to be discussing today is, what if Social Security doesn't know what SOAR is? How can I change this? Or what if DDS does not know what SOAR is? How can I establish a contact? So for anyone that's brand new to SOAR, or perhaps you haven't yet completed the SOAR online course and you're not familiar with all the acronyms, because there is a lot of acronyms involved in Social Security, in the Social Security world. So SSA is the Social Security Administration. DDS is the Disability Determination Services. Social Security processes the SSI and SSDI applications, and they determine a person's non-medical eligibility for either SSI or SSDI. And then once they process the applications and determine non-medical eligibility, then the application moves on to DDS, Disability Determination Services. And DDS determines a person's medical eligibility. So it's kind of two different agencies that you, as a SOAR provider, are collaborating with during this process when you're helping the applicants that you serve. So in some parts of the country, some states, some localities, there is a strong collaboration with both SSA and DDS. There may even be points of contact at local Social Security offices. There may be points of contact at Social Security offices throughout some states. And the same goes with DDS, but that is not the case. I'll be completely kind of honest, is that that is not the case everywhere in the country. And that doesn't mean that that can't be developed over time. So you may encounter, perhaps you're in an area where, you know, maybe you're one of a few SOAR providers that are submitting applications to Social Security. So there's not a kind of organized SOAR effort in your area. So it kind of makes sense that perhaps there might not be a SOAR point of contact at the local SSA field office. So we have a guide that we developed, and this is on our website, and I'm sure one of my colleagues can put a link to this in the chat. This guide is called the Guide to Collaborating with the Social Security Administration and the Disability Determination Services. So if you are encountering, when you submit applications to Social Security, or when you contact DDS for the applications that you're assisting with, that they're not familiar with what SOAR is, I recommend checking out this guide. Kind of the purpose of the guide is to help you and hopefully the other people using SOAR in your community to develop those successful working relationships with both SSA and DDS. The guide also provides examples of how these successful relationships with SSA and DDS can benefit both those two agencies, SSA and DDS, and the SOAR trained caseworkers. And of course, you know, first and foremost, the applicants that are applying for disability benefits. Within the guide, you'll find strategies for kind of collaborating, and I like to refer to them almost as like kind of like talking points for you to kind of educate the local Social Security field offices about what SOAR is, and you know, what strategies you're using that with the SOAR model to help individuals experiencing homelessness submit these applications to Social Security. So some of the strategies included in the guide for collaborating with SSA include working to set up a designated SSA liaison for SOAR providers at the local SSA field office, inviting local SSA representatives to community meetings, community SOAR meetings. If there's not a community-wide SOAR meeting, perhaps inviting an SSA representative to an agency meeting, just with your agency that is getting started with submitting these applications to SSA. Some of the strategies involved or included in this guide for collaborating with DDS involve kind of talking to DDS about kind of what you'll be doing as a SOAR provider to assist them with the processing of the medical determination for these SSI and SSDI claims. So things like helping the applicant to collect and submit their medical records using a barcoded page, or submitting the medical records through Social Security's Electronic Records Express, Also talking to DDS about the medical summary report and how it provides a detailed functional description of the applicant and how their functional limitations prevent them from working. So those are just kind of an overview of some of the information that's provided within this guide, and definitely encourage you to check it out. In addition to this, if in addition to reviewing the guide, if you're getting started with this work and you're running into any troubles with SSA or DDS, just in terms of submitting applications or lack of communication, anything like that, I strongly encourage you to reach out to your SOAR state team lead and your SOAR TA Center liaison. That's kind of two separate people. So each state, or most states, have a SOAR state team lead, and then there's always a SOAR TA Center liaison for each state as well. Reach out to them, to us, and ask if there might be a point of contact at the local SSA field office that you're submitting applications to. There's a chance that there might be, but you just might be unaware of it because you're just getting started with the work. And if there's not, we can do our best to try to help kind of make a connection and get that established. And the last thing I'll say about this is that even if there's not a designated point of contact for SOAR providers at either the SSA field office or DDS, you can still submit these claims for the individuals that need this assistance. And if you have any questions about that, definitely reach out to us at the SOAR TA Center. We can kind of talk through strategies for how to navigate these claims at the SSA field office and at the DDS offices that they go to. But I kind of like to say, keep it simple when you're talking with SSA, and just kind of briefly explain what services you provide as a SOAR provider. So saying, kind of simple things that SSA will understand, like that you're serving as the person's SSA 1696 representative, but that you're generally SOAR providers are non-attorneys. Some might be attorneys, but you're not accepting fees. You're submitting the 1696 and representing the applicant, but you're not accepting fees because the person is experiencing homelessness or at risk of homelessness. That you're helping the person to complete all the paperwork associated with the SSI and SSDI application, and submitting that and following up regularly with SSA and DDS throughout the process. Then that you're helping the person to collect their medical records and writing a medical summary report that will then be submitted with the application process, just to help SSA and DDS know what you're doing to assist the applicant. All right, so I'm going to move on to the second frequently asked question about documenting substance use and co-occurring disorders within the medical summary report. And just a reminder that the medical summary report is one of the SOAR critical components. It is a very important piece of the SOAR model, and it thoroughly documents the person's conditions that's causing them to be unable to work, their treatment history, the signs and symptoms associated with the different diagnoses that they might have, in addition to thoroughly documenting the functional limitations that they have as a result of those conditions. And so we know that a lot of applicants that you might be assisting with applications may have a mental health condition. They may have physical health conditions as well. And a lot of folks will likely have substance use in their past as well, or current. And so documenting substance use in the medical summary report is something that you will likely have to do. So just a couple tips we have here on this first slide. Before including information in the person's medical summary report about their substance use, you want to make sure to state, because remember that substance use is not something that someone can be found disabled for. So you want to make sure to state what the person's physical or mental health diagnoses is that's causing them to be unable to work before you kind of dive into their current substance use or substance use history. The way Social Security looks at substance use is that if the person's substance use is deemed to be material to the person's disability benefits, to the person's disability, then their disability benefit application will be denied. And what material means, what the basic meaning of material is, if a person were not using substances, that their functional impairments would not exist. And what that, going a little bit further, is that if the person were sober and they weren't using any sort of substances, their mental health conditions aren't severe enough to meet Social Security's definition of disability. So what you can do to assist when writing the medical summary report is to, when you collect the person's medical records from the various places that they've received treatment from, recent and in the past, to kind of read through those records and to look for periods of abstinence from substances, and to document their mental health symptoms that occurred in the absence of substance use. And I'm going to give a few examples on these next couple slides here. So this is, I won't read all of this to you. I just wanted to be able to provide a few examples of how to document substance use and continuing mental health symptoms in the absence of substance use, so that you kind of have them and you can get a copy of these slides. So this is kind of a sample description for Colette Rose, who was one of the practice case applicants in the SOAR online course. So on this first slide here, I have 4 slides total. On this first slide, this gives an example of how to document what a person has been diagnosed with in terms of a substance use disorder. So Colette was diagnosed with alcohol abuse. And then it kind of also goes into, why Colette reported using substances. So you can see the other highlighted part on this slide, that Colette's alcohol use started when her stepfather began to sexually abuse her. He would give her beer, and Colette felt that the beer numbed the pain of the abuse. Colette also reported that she drank alcohol to help her sleep while she was experiencing homelessness and living in her car. And so it also includes some kind of references to the medical records that we pulled this information from. So you always want to make sure that when you're including information about a person's treatment or what they're reporting, that you can kind of cite the medical record that it comes from. And you want to make sure the information is consistent, that you put in the MSR that is also in their medical records. You don't want conflicting information. So this next slide here is, and I'll read some of this just to kind of give an example. So I'll start here. Colette's various medical and treatment records confirm that her mental health symptoms continue to cause her significant functional limitations in the absence of substance use. In January of 2012, Colette was picked up by police in the community while she was experiencing a manic episode. She was harassing a store's patrons and yelling at them to buy a copy of her book. She was talking rapidly. She could not focus on the police questions and began hyperventilating. She then had to be taken to the hospital. She stayed at the hospital for almost 4 days before she was stable enough to be released. And then just making a note and telling DDS that these hospital records are going to be submitted with the complete application packet. So this is an example of citing information from a hospital record to show that Colette's mental health symptoms and severe mental health symptoms continued in the absence of substance use, because those hospital records documented that she tested negative for all substances upon admission. And this next slide here is referencing Colette's treatment at a substance use treatment program. So she received substance use treatment for a month. So it's important that if the applicants that you are helping have received treatment from substance use treatment programs, that you collect those records as well, and look at those records to see if they document any examples of the applicant experiencing mental health symptoms or functional limitations during the treatment episode. And generally, these are going to document if what the person's urinalysis results were as well. So you'll see here, this documents when Colette went to treatment for substance use. It documents the examples of how Colette struggled with her depression while she was in treatment, how that affected her ability to fully engage in the treatment, and then also documents that she tested negative for all substances throughout this treatment program, and then references the counselor she had in the treatment program, and again, alerts DDS that these records will be submitted as part of the disability application. And then the last example here is, and this is kind of goes back to Dazara's presentation about working with individuals in institutional settings. This is an example of documenting how Colette's mental health symptoms and functional limitations occurred during her incarceration at any county jail. She received a referral to mental health services. She saw a psychiatrist while she was in jail. There was documentation of some depressive symptoms that she experienced while she was in jail. You're including dates because you always want to make sure that you're documenting recent examples of this to DDS because they're really focusing in on that last year of the person's history and their mental health treatment. And so, and then again, alerting DDS that this is just kind of a snippet of the information that you found in the medical records, and that you'll be submitting these records as part of the application packet. So feel free to check out these examples and kind of use them as models for documenting in your own MSRs for the applicants that you assist. All right, with that, I'm going to turn it over to my colleague, Sumitra Pocoto.
Great. Thanks so much, Dan, and good afternoon, everybody. Very excited that you're all joining us here today. So my name is Sumitra Pocoto. I'm a project associate. I work remotely from my home in Buffalo, New York. So I'm the liaison to a couple states, mostly in the Northeast, couple down south and out west. So Alabama, Indiana, Massachusetts, Maine, North Carolina, Rhode Island, Texas, and Vermont. Hello, if any of you are on the call. I have a particular subject matter interest and expertise involving integrating peers into SOAR work. And just a little bit about me, it's just me and my mama, and we love to travel, I love to read, and I am a proud member of Hufflepuff House, so if there's any other Hufflepuffs in the house, hello. So I'm going to be walking you through a couple of some of the most frequently asked questions that I get over the course of doing this work. And a really common one that I often hear is, I'm having difficulty getting my medical summary report signed. What kind of tips can you provide? So in terms of answering this question, so as we all likely know, the medical summary report is a key critical component within the SOAR process. This is the document in which SOAR providers are able to provide they were able to provide information on the limited functionality of the applicant. They're really able to draw from the clinical records, draw from their observations, draw from interviews with the applicant to really tie all that information together and demonstrate how that applicant's conditions or diagnoses have impacted their ability to function and thereby work. So it's a really important document. And often what I found throughout my experience, whenever I've attempted to get the MSR signed, and if I experience any kind of pushback or hesitancy about it, oftentimes the cause behind that hesitancy of signing is really just a lack of knowledge about what the medical summary report is and why it's so important and why that co-signature is important. And so a couple of tips and things I've kind of learned along the way and experienced along the way that was helpful was I learned that it was really important to build relationships with medical providers early on in the process, right? And we can look at that a couple different ways. I know for me personally, when I had clients that I was assisting with SOAR-assisted applications, I would often try to go with them during their medical appointments, right? So that their providers knew who I was, they knew what my role is, they knew I was assisting the person with an application, they were familiar with me, my name, things like that, right? So really kind of building those relationships early. And just kind of being able to provide those medical providers or those medical facilities important information about what medical providers need to know. Oftentimes I've experienced in conversations with medical providers that they were under the assumption that they were the ones that had to make the determination of whether they thought the person was considered disabled or not. And just simply having a conversation with them explaining that while their information, their clinical information is important to provide, that they are not necessarily the ones that needed to make that determination, right? So really just being able to speak with them about what the medical summary report is and what their role is in relation to that, I found to be really helpful. At the TA Center, we have a really great resource, which I think my colleague linked in the box already. But we've got a great article on what medical providers need to know. So if you're in this situation and you're kind of looking on some guidance on how best to have these conversations or what you think important information is to give to them, I definitely recommend checking out that resource. One other last tip that I would really recommend is to make friends. And when I say make friends, what I mean by that is, are there other providers within the facility that can assist you with passing the document along to get signed, right? Oftentimes for many of the individuals that were referred over to me by like care coordinators or other caseworkers or other people within the organization, right? Oftentimes, like I'd already have a relationship established with them. So I would go to them and kind of pass along like, hey, you know, this is the medical summary report. This is why it's important. We really need a co-signature on this. Do you think that you could pass this to the doctor to sign or talk to them about it? And there was a pretty good success rate with that, right? Because even if we don't have a relationship with the medical provider, that person within that facility most likely already does, or can at least kind of help facilitate that conversation. So definitely make friends and build those relationships early. Another frequently asked question that I often get is, how do I work with applicants that are difficult to engage? And considering the population that we serve and considering the wide variety of experiences they may have, experience with the system or with other providers, this can sometimes be a common experience for SOAR providers, right? Is that we are attempting to work with and engage with applicants that may be a little bit difficult to engage or may only want limited engagement. And in terms of we've got some tips listed on the slide here that can really kind of assist you in terms of how you approach your engagement with the individuals that we are attempting to serve. I think the most important part of within this, right, is that we are attempting to build a space with trust and respect, right? And key in that is that we always want to be mindful to meet the person where they're at. We want to meet them where they're at and just kind of adapt to that. So that might mean a couple things, right? That might mean finding out where the person spends their time, right? If this is an individual that tends to be transient, maybe, I'm going to operate under the assumption that they may not be comfortable coming into my office. Maybe if my job allows, right, I'm going to go out and meet them somewhere in the community or meet them somewhere closer to them or meet them at the park where they spend their time, right? That might mean being mindful to be open to questions and maybe having to explain things in a way that they will understand or in their terms, right? That might mean being mindful, intentional about language, under promising and over delivering. I think another key tip on this slide that I found to be really helpful was developing ways to maintain contact. And what I learned over my experiences was that it was helpful to, within the first couple of appointments, maybe the first one or two, was to really kind of start writing down like all potential sources of contact should this person go MIA. I kind of always had the mindset of like, oh, at some point my applicant's gonna go MIA or their phone's gonna break or something's gonna happen, right? So literally like writing down if they have emergency contacts, right? If there are family members they keep in contact with, if there are providers that that they do see on a regular basis, right? So really kind of just writing down like really early on from the jump, like who some potential contacts might be, can often come in handy later. We also just want to be mindful to take a trauma-informed approach, really throughout all aspects of the SOAR application process, but especially throughout times where we are interviewing or talking to them, most likely for when we're gathering information for our medical summary report. We want to be mindful that our applicants likely have a really, really wide variety of lived experiences that may have impacted their willingness and ability to provide information or their willingness and ability to engage with us. So we just want to be appropriately responsive to this. We want to also be in tune with ourselves and be mindful how different various aspects of the applicant's life and background and different categories of diversity might be impacting us as well. We really encourage you to really be mindful and intentional about how we ask questions, right? We want to, of course, ask them in a sensitive and respectful way. We want to really only ask questions if they are relevant to the purposes of our MSR, right? And when I say purposes, meaning that it is key to either demonstrating limited functionality, or maybe it contributed to it some way, that it should have some kind of relevance, right? And really, we should always be asking ourselves, like, does asking this information help provide insight into the applicant's functioning? This process, the thing with this process, because we are so focused on demonstrating severe limitations, sometimes we can lose sight of that this could be really, really hard conversations for the applicants and the people that we are serving. It's not always going to be a strengths-based process, but if we approach from a trauma-informed perspective, that we can at least make it a little bit. So I'd encourage you all to consider that. And the last frequently asked question that I often get is, can peer workers assist with SOAR applications? And the answer is yes, 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 absolutely, 100% yes. Considering the wide variety of roles that peers play and the wide variety of settings that peers work in, there is almost no part of the SOAR process that SOARs cannot and do not make better. So the SOAR online course is open to the public. Anyone can take that. And we encourage, those of you, if you're on teams with peer staff, or if you're supervised peer workers, we definitely encourage you to encourage them to take the course. Peers, as we know, have a very, very unique role, right? It's not necessarily a case manager junior or case manager light role. It's a very unique role where they can utilize their lived experience with, who knows, right? Homelessness, with mental health, with being a veteran, with being an immigrant, right? They can take that lived experience and use that to help others navigate the benefits application process. I often like to use the analogy of, if we were, imagine like if you were planning a trip somewhere, right? And you're sitting there and you're like, I'm trying to think of things to do, right? You are much more likely to go and get the advice or ask somebody who either lives there or who has been there before, right? Because they're there, they're in the thick of it. They experience it every day. They know it. They're the expert, right? You're much more likely to go ask someone who's been there or who lives there over somebody who like maybe watched a show about it like on the Travel Channel, right? Now, does that person have some experience because they watched that show? Sure. But you are much more likely to go consult a person that has lived through that or lives through it every day, right? And I look at peer workers and the ways that they can positively impact the SOAR application process in the same way. The only thing I do want to add on, though, is just to be mindful of role drift for peers. And so some peer roles are completely suited for doing the full SOAR application process, whereas some peer roles are better suited for doing more supportive tasks. So you'll want to definitely, if this is something that you're looking at or interested in, this is definitely something that you would want to really kind of take some time and look at what is the clarified role of that peer in that agency, that organization, in that community, and how their defined role can play a part within the SOAR process. I also encourage you to check out a resource that we've created at the SOAR TA Center, which focuses and talks about how integrating SOAR within state peer certification. Sorry. So each state does have a specific certification process, and it's going to look differently depending where you are. But this guide really provides some good guidance on how, if you were interested in possibly thinking about, how can SOAR be a part of the peer certification process? Or, hey, can we, we have a lot of SOAR trained peer staff in our state. Can we get this course approved for continuing education credits? Or can we come up with an endorsement? So this issue brief provides some really practical kind of steps and guidelines for how one could do that. And with that, I'm going to turn it over to Pam.
Thank you, Sumitra. So again, my name is Pam Hyde. I'm a senior project associate at the TA Center. I provide state liaison support to the states of Kentucky, North Dakota, New Jersey, Nevada, Wisconsin, and West Virginia. Prior to coming to the TA Center, I was with our state legal aid organization for about 13 years, where I represented applicants in all levels of the appeal process. So I provide some technical assistance support for applicants who have been denied, and work with case managers on how you can utilize the SOAR model with appeals that I'll talk about. And when I do have some leisure time, I like to scope out some of our public golf courses in the tri-state area where I live. I also have a rescue dog, and because I am from the Jersey Shore, you have to like Bruce Springsteen. So the question that I get is, can you use the SOAR model with appeals? And the answer is absolutely yes. You can use the SOAR model with appeals, in particular the reconsideration level, the first level of appeal that I'll talk about on this second slide. But here are just some numbers that show you that For case managers who have reported outcomes, they've been successful with using the SOAR model, with helping a little over 17,000 individuals through the appeals process. And that's with a 50% cumulative approval rate in an average of 177 days for 2022. Now we break that down to the first level of appeal, which is reconsideration, which has a 36 approval rating. And that may appear low, but in actuality, when you compare that to the national approval rate of 13%, using the SOAR model is effective. And at the hearing level, for some of those case managers that do appeals at the ALJ level, there is a 59% approval rate. And comparing that to the national average of 45%, using the SOAR model certainly does work as well. So the first level of appeal that we certainly encourage case managers to assist applicants who are denied at the initial level is because it's the same process as the initial application level. That case is heard again at DDS with a new claims examiner and a medical reviewer. So we really do encourage you to assist the applicant at the reconsideration level. All states do have reconsideration, and if an applicant is denied at the initial level, you do have 60 days to let Social Security know that you want to file an appeal. And if you've missed the deadline, I will talk about that in an upcoming slide too. It's very easy to file an appeal. If it's within the 60 days, you can apply online. There is a process to do that online. If you represented the applicant at the initial level and your SSA 1696 is in the system, you can file the appeal on behalf of the applicant. You're able to do that. And the forms are a very simple request for reconsideration. There is a disability appeal report, which is very similar to the disability report, the 3368 that you use at the earlier level, because you are asked to provide an update on treatment, symptoms, any worsening in their functional abilities you're able to report on. And most importantly, submit updated medical documentation, maybe a medical summary report if you didn't submit one at the initial level. So there's a lot you can do at the initial reconsideration stage. I think most case managers are successful because they're able to elicit information about other impairments that the applicant may not have disclosed at the earlier stage. And maybe the assessments or the applicant wasn't able to really get into treatment until later on in the initial process. So you will likely see hopefully an approval at the reconsideration level, because now you have that medical documentation that you can submit and share. So really encourage you to take a look at helping folks at this level. So some folks will wonder, should I start a new application or should I just appeal it? Now, with reconsiderations, we certainly recommend that you appeal it, because that protects the original protective file date. So when they get awarded benefits, they'll get benefits back to that date of the application when it first started. If you start a new application, there's the potential loss of back benefits because you're using a new application date. But you really want to make sure that the applicant knows, really what they're giving up, so that they make an informed choice with that. So I mentioned earlier that what happens if you miss an appeal deadline? Well, Social Security does offer something called good cause for late filing, and this could be a day late or a week late or a couple months late. So there's many good cause reasons, and if you look here, often SOAR applicants will not have received the notice because not having an address. So that's one reason. Having a mental health diagnosis, which makes you really maybe not understand the process for applying, limited English proficiency, and really being in the hospital, so you couldn't make that deadline because you were hospitalized. So we have sample good cause letter. Even during COVID, there's some language, that they'll make it easier for the local Social Security office to grant good cause. So take a look at that should you be in a situation, because there are benefits to continuing that application. So if the applicant wants to appeal the reconsideration, how can you help when you're not able to continue that representation with the ALJ hearing? That's called the administrative law judge hearing. That's when most applicants get maybe an attorney or a paralegal or another advocate involved who's comfortable with doing hearings. But there are things that you can do as a SOAR caseworker to be able to help the applicant should they wish to take that case further in the appeals process. We recommend developing partnerships with your local legal aides who, again, don't take back benefits. They can help that applicant knowing that you have fully develop that case with medical records, and maybe you can assist the applicant with getting to the hearing, maybe updating the medical record or the case file with updated medical records. So again, we encourage you to develop relationships with your local legal aides, maybe private attorneys, because they have pro bono obligations. Your county bar associations, law school legal clinics, they're often looking to assist applicants at this level. So we have some guidance on how to kind of promote these relationships as well. And again, here are some of the resources that you want to check out should you want to continue the application with the appeal, specifically maybe with that hearing level. So here's more guidance, and feel free to reach out to me for some one-on-one case consultations and how to get more training on how to do hearings if you would like to do that. So now I think I am handing it off to Kristen.
Sorry, I think I was double muted there. Hey there, thank you so much, Pam. How great is this SOAR team? I find myself so grateful to work with everyone who's presented so far, and all of you in the audience who are working on SOAR applications. So my name is Kristen Lupfer. I use she, her pronouns. I am the project director of the SOAR TA Center. I am in my 15th year of SOAR. I love this program and everyone who's working on it. So glad to be here with you today and having you all get to know us and this work a little bit more. I am the liaison to Washington, D.C., Maryland, and the state of Washington. I love to support new programs in their program development, in their collaboration building, and have a soft place in my heart on employment integration, and love to see people encouraging individuals to work. I am, as you can see from the picture, I'm the proud mama of a 9-year-old and 5-year-old, and we love to play here in the mountains with their dad and our dog Banjo. I love to organize things, and I'm really enthusiastic about coffee, as you can see here in these photos. So, all right, here we go. So a question that we get a lot is, will an applicant be denied if they're working during the application process? And the answer is yes, you can work. And we encourage work. So, it just breaks my heart every time I hear someone say, oh, you know, so-and-so told me I needed to quit my job. I needed to stop working in order to apply for disability benefits. So what we know is that you can be working while you're applying, and the measure is really about how much it is that you're earning. So if you all remember from your online course training that substantial gainful activity is measured at earnings per month. And it's the first step of the sequential evaluation. And so SSA is looking at, is the person working and earning $1,350 a month this year, and next year it's going to be $1,470. So if they're not, if they're earning less than that, they're still eligible for benefits. And if they're working and earning a little over that, and they have work incentives that might reduce that countable income, there are ways to show that yes, someone is able to work at some capacity, but not at a substantial gainful level. And let me explain to you why that is and what it is about their illnesses and conditions and the functional impairments that go along with them that's impacting their ability to work at that substantial gainful level. What we do encourage you to do, if someone is working during the application process, you'll want to complete an SSA 821, which is a work activity report, and it helps to explain to SSA and DDS how the person is working, how that's impacting them. You can give a little bit more information there. So we have an article on our website that explains how to complete that form and how it's useful. This infographic that's displayed on the screen here is our myth-busting tool. It's a resource that you can share with program participants. It has resources and information on the back and helps to bust some of those myths out there about working while applying for and receiving disability benefits. All right, so one of those questions that we get is, can an SSI or SSDI beneficiary work more than 20 hours, or will their benefits get cut off? So that's another one we hear a lot. Oh, you know, 20 hours, make sure that you don't work more than 20 hours. So it's not about the number of hours that you're working. We know that it's about the amount of earnings that you receive. But we want to just try to establish some facts to help dispel myths. So we don't want to repeat the myths for folks. We want to have people hear what those facts are. So fact, individuals with behavioral health conditions do want to work. Fact, individuals can work while applying for and receiving Social Security disability benefits. And fact, it is possible to combine income with VA, SSA, and employment, depending on the benefits received and the amount of work. So we are all about maximizing income and maximizing the benefit that individuals get from working in their communities and having that connection. So it can get complicated. Dan was saying he's gonna be honest about those SSA and DDS collaborations. I'll be honest about this too. SSA's work incentive programs are generous, but they are complicated. But there are resources out there to help individuals navigate those programs, Social Security funds, work incentive coordinators, and others out there, benefits planners who can help people figure out what work will do and how it will impact their benefits and how they can maximize that income and maintain their benefits and maintain their work income and the benefits that they receive from that. So because we believe that employment is so important and that we know that people can increase their income by working and receiving their benefits, we want to encourage SOAR providers to talk about employment. Talk about employment from day one when you're engaging with someone, you're working with someone, you're talking to them about what their needs are, what their income needs are. And they say, I want to work, but I think I need to apply for disability. I've been struggling with this. What should I do? Or I don't have a lot of work history. I don't know how to explore that. So we developed an employment conversation guide, which will help give you some of the questions to ask. And then based on those responses that folks have, maybe some of the responses back or resources that you can provide to them. So not only do we have the conversation guide that will give you some questions to do that exploration with someone, but then also what you can do and provide to someone based on how they reply. All right, so one of the major things that folks are worried about is losing their health insurance. So this is a frequent question we get. What happens to that health insurance when an SSI or SSDI beneficiary starts working? Sometimes it's the health insurance that is even more valuable in helping someone maintain their wellness and their recovery, and they don't want to lose that. That's really important. So with SSI and Medicaid, there's a really generous benefit where Medicaid can continue under Federal Rule 1619B, even if SSI cash payments stop. So let's say, someone has gone back to work, they're earning good money, they're doing well, they're stable, and they're earning enough that eventually that SSI payment ends. If the individual's earnings remain below a state threshold that is fairly high right now, they're able to keep that Medicaid going. So the special rule to keep them on the Medicaid eligibility roster, even if they're no longer receiving that cash payment. For Medicare and SSDI recipients, they have an extended period of time where they can keep their health insurance. It's 7.75 years, very specific number, after their last month of their trial work period, and then it can be purchased after that. So we've got a lot of great information on the SOAR website. This article in particular gives a nice brief overview of SSA work incentives and how they can be utilized to maximize income for folks. All right, so last but not least, I'm going to turn it over to Susie.
All right, hello everybody. I know we're reaching the end of our time, so I'm going to go through the information on OAT fairly quickly. So I'm a senior project associate with the SOAR TA Center. I am the OAT administrator, online application tracking, which is what I'm going to be talking about today. I also help out quite a bit with the website and the course and a lot of the techie things. Unbelievably, my two daughters, Emily and Abigail, are both now in their 20s. I made it through the teenage years. Enjoy traveling with friends and family, ideally to a beach, and love any kind of board games, as noted there, when I am not working on SOAR. So first question, how can I track my SOAR assisted SSI, SSDI outcomes? We have a great online web-based system called OAT, Online Application Tracking, and there is the website right there. Hopefully one of my colleagues can put that link in the chat as well. And so that's what you can use. We're going to talk about what OAT is and a couple of frequently asked questions about it. So one thing about OAT, first of all, is that purpose is for tracking the outcomes. In other words, the decisions received on SOAR assisted SSI and SSDI applications. The system does not communicate at all with SSA or DDS, HMIS, or any other outside systems. The name is a little bit deceiving, OAT, in that it uses the word tracking. It doesn't have any communication with SSA or allow you to see the current status of an application that is being decided, but it is about tracking your outcomes. So you have to pass the SOAR online course before registering for OAT. Again, because the whole idea is for us to look at SOAR assisted applications. So you do have to pass the SOAR online course. And once you've done that, you can visit OAT and register for an account. There is one caveat to that, and it's a frequent question that we get. We hear from folks who are supervisors of SOAR trained staff and need to see the outcomes that their staff are entering into OAT, but they haven't taken the online course. Can they still register? And that is an absolute yes. When you register for OAT, and there's an image of the registration page on the left, you can select your role. If you've been SOAR trained and you're just going to be entering your own outcomes, you're going to choose caseworker, but there's also an option to choose a leadership role. A state team lead or a local lead, those are kind of higher level SOAR roles that someone who has attended one of our leadership academies or has a state level role with OAT. But as an agency lead, the option is that you can choose yes to the question about, are you a supervisor only? In other words, you won't be entering your own application outcomes. You can choose yes to that, and that will allow you to bypass the required date on your certificate that's asked for when you register as a caseworker. And you can register and you can see all the cases that are being entered by SOAR trained staff at your agency. Another question we get from users is that they have an OAT account, but they get a new job. They change agencies. When they go to their profile page, why are some things grayed out? Why can't they change their agency? And this is because cases that are entered into OAT will always be associated with the caseworker that entered it, but they kind of belong to the agency, so to speak, because that agency exists in a certain city, county, state, etc. And that's the way we look at a lot of our national outcomes. So if you do have an OAT account already and you have switched positions, you will need to register again. So you'll just go to the SOAR OAT page and choose the option for creating an account just like you did the first time, and you'll put your new information in there. When you go into OAT and you want to enter the decision of a case that you have assisted with, you have to create an applicant ID. This ID number, you make it up. It does have to follow a pattern of 2 letters, 2 numbers, 2 letters, 4 numbers, but there's no personally identifiable information. You have to write down this ID number in your hard copy files. If you call us and say, I can't find the information I entered for John Smith, we're not going to know anything about John Smith because we don't collect that kind of information. So you'll want to make sure that you know what that app ID is. App IDs can only be used once across all OAT users. So often we get a question about, I'm trying to create a new applicant. I'm trying to, put the numbers and letters in to create it, and it's not accepting it. So it doesn't necessarily mean that that applicant, again, because you're just creating an ID number, it doesn't mean that that applicant is already an OAT necessarily. It just means another caseworker who uses OAT from somewhere across the country has already used that ID number. So just pick a different one, change one letter or number. It's important that you just write that ID number down so you know what case it's associated with. The other possibility is that maybe you're accidentally entering the numbers first. It won't let you do that. It'll make you go by that pattern. Wondering about how to make edits to a case that you have already started to enter. When you create that app ID, you'll put some demographic information in about the applicant. You'll pick what type of application it is, initial or reconsideration. And then you can enter some other information and you can save that and come back later to enter the decision. So when you go to your applications page to see all of your cases, you can either click on the app ID number or you can click continue. And those are your options for going back and making changes or updates to a case that you have entered. One thing to keep in mind is that once you have entered a decision, you cannot edit any information about the case in terms of the dates of things and other details. One thing you can do, however, is enter further information, what we call post decision. And this has to do with if a case is approved, what the benefits are that that person is receiving, how, if there's any back pay they're going to receive, all of those pieces of information that come after the approval is received. So at any time, you can go back and edit that page, and it's tab 5, it's the final tab of entering a case. But once you have entered that a case has been approved or denied, you can't go back and change demographic information or the information that's collected about the SOAR critical components. So if a case, however, is denied, again, you can only do the post-application, make edits to the post-application page. And at that point, if an initial decision is denied or initial application is denied, the next question will ask about whether a request for reconsideration was filed. You don't need to create a whole new app ID for this person. You can just say yes, and the next page it will take you to immediately is to enter information about the reconsideration. No need to go back and create a new app ID for that person. And then, Pam was just talking about appeals. Very often people ask this question that they want to answer yes for this because they know that this applicant has filed or wants to file for an appeal, but their agency doesn't do that. They've referred this person out to, let's say, legal aid. You can answer no to this question. And it is hard to answer no sometimes because you want to say, well, yes, I know this person went and appealed, but for the purposes of OAT, we are just recording SOAR assisted activity. So if you refer that person out, you're going to want to answer no to this question because you, as a SOAR caseworker, utilizing the SOAR critical components are not the person who assisted with this appeal. And finally, on the SOAR website, you can access our user guide, our reports guide. There's the email that you can ask any question about OAT or questions about your ability to log in or create an account. We are always here to answer those questions for you. So I think I'm turning it back over to Pam.
Yeah, well, I'm going to ask everyone at the TA Center to camera up. We answered over 40 questions during this hour. So it just tells you that you're all have questions that we are more than happy to answer and provide a thoughtful response. So as you can see here, we're all very accessible. You can reach us by email, you can reach us by phone. We'd be glad to answer your questions, but check out some of our additional resources. Go to our frequently asked question page. See if that question has been answered and that meets your needs. If not, feel free to contact your liaison for more in-depth response. If you didn't have a chance to ask your question as part of the evaluation, which we ask that you complete, you have an opportunity to put a question in that we'll be able to respond to you. So really encourage you to do that. Also, hopefully this gave you a good idea of what our Soaring Over Lunch calls are like. If you have not joined one, we encourage you to do so. We answer these types of questions in rapid fire fashion from the TA Center staff, similar to kind of what we're doing here. So again, I thank you for joining us, taking the time to pose your questions and hear from us, getting to know us a little bit more. And we hope that we hear from you soon. Our next Soaring Over Lunch is actually November 15th at 1 p.m. And thanks again for joining us. And we look forward to seeing you on our next webinar, which will be December 8th on the topic of long COVID and how to evaluate that. So again, thanks so much and have a great rest of your evening. Thanks again.